Your community is here to serve with essential products, services, care, and compassion. And today on Here to Serve, we're joined by Elizabeth Mauro, Executive Director of Endeavor Health Services, to learn about how they're stepping up during this crisis. Good morning, Elizabeth.
Hello, good morning.
Have you been busy in a good way, in a helper way lately, or what?
We certainly have. We've been busier than ever, but we're happy to serve.
Now, Endeavor provides mental health and substance abuse services to Western New Yorkers. Both have been, well, they're often in tandem, especially in pressure times like this. Give us a little history about Endeavor and what you're doing today.
Well, Endeavor's been around since the 1970s, and we are a certified community behavioral health clinic, one of only 13 in the state. And that means we provide excellent mental health treatment and counseling services that are all evidence-based, as well as a whole slew of supportive services. And we're doing everything remotely now, so we can reach people right in their homes by telephone, Zoom meetings, face-to-face that way, using remote technologies. It's a pretty wonderful advancement in how we can reach people.
What do you mean by evidence-based?
So that means the treatment methods and modalities that we use has years and years and years of research helping to support how we go about helping people achieve the emotional wellness and mental health and recovery from addictions that we want. So we'll use things like cognitive behavioral therapy, family systems therapy, those sorts of things. So it has evidence to support that what we do is effective.
And the focus on mental health right now, we talk about it in various ways almost every single day, because with what we're going through, everybody is going to have that day where they feel a little off for whatever reason. What kind of things can people do on their own for when they feel a little off to get back on track?
I think one of the big things I'm concerned about is the feelings of isolation that people experience, and so that's the time to connect and to realize that you're not alone. We're here, we're open. You can call us here at Endeavor at 895-6701. You could call a friend or a neighbor. Take a walk. But I think, remember, having that structure and purpose to every day, it's a wonderful time to set plans and goals for ourselves and maybe focus on ourselves in a way that we haven't had the time to do before because we've been so busy with our daily routine. And
at the end of this, we'll give the phone number and the website for Endeavor Health Services again, chatting with their Executive Director, Elizabeth Mauro. I've talked about balance, mental and physical balance on the air a lot, where when I feel off, my balance is I go down to the basement. If I can do a mile or a mile and a half on the treadmill, I know I'm okay. And you talked about structure. Normalcy is structure. We are not normal right now. How do people work structure into their everyday lives?
Keeping any routine that serves you well and making sure that you have it. So it's getting up at that set time, making sure you get out, you change into out of your jammies, those sorts of things.
Yeah, you're right. Little things like, what's the old saying? If you make your bed the right way in the morning, that's going to change your entire day.
Yes, absolutely. Absolutely. Otherwise, you start to drift, and there's no structure or routine. So keeping those daily kind of routines is so important, and we can all do that.
Let's talk about substance abuse, another thing you deal with, because liquor sales have gone up. I've talked about how, hey, I've been 2 o'clock in the afternoon, which is different for me because I get up at 4 a.m., maybe a cocktail. Have you gotten more calls from people saying, boy, I'm drinking more than maybe I thought I should, or I want you to check on my husband, my wife, or maybe a relative or friend that I know?
Yes, absolutely, and I'm glad you bring that up. So stress can produce all sorts of habits that aren't necessarily very helpful for us in terms of either drinking more than we should, eating all kinds of sugar and junk food and all these things.
I've done that, yeah.
Right? And it's how we manage stress. So we're getting a lot of calls, even to just do like family meetings and help deal with some family tensions and stresses that all bubble up to the top when we're together so much. So I would tell everyone moderation in everything. Okay, so this is not the time to kind of derail whatever great health benefits that you've put in place for yourself. Now's the time to focus on them more.
And for people who want to get a hold of Endeavor Health Services, it's 895-6701, 895-6701, or on the web, ehsny.org. How does insurance work? The costs are going to be person by person, but how does it all work? Is somebody has no insurance, but they still need help?
So we see everybody, regardless of ability to pay. We accept all insurances, but we also see everybody. So we offer charity care, sliding fee, slots, you name it. We'll make sure we won't turn you away. And even more importantly to know right now, all copays and fees are waived in New York State for our telehealth services. So just call us. It's free.
That's great information. The number 895-6701, Endeavor Health Services. Thank you so much, Elizabeth.
Thank you.
Elizabeth Mauro, Executive Director of Endeavor. Thanks to them and all the local organizations that are putting our community first and making sure we know that they are here to serve.